Hello, my name's Willie and I was diagnosed with prostate cancer in July 2023. A diagnosis like that can make you feel weak, fragile, vulnerable. That's how I felt. There are different types of treatment. I was started straight away on hormone therapy the day after my diagnosis, and I'll be on that for the rest of my life. This type of treatment has some side effects, including loss of muscle and strength. I know from first-hand experience that taking steps to build up your strength can really help you take back control, reduce side effects, and make the treatment more manageable. Testosterone levels naturally drop as you get older, but starting hormone therapy makes this happen much more quickly. Your hormones play a big part in regulating a lot of your body's functions, including muscle growth, fat production, and bone strength. So, it's important to understand how these changes could affect you and what you can do to manage them. This video should give you some ideas to get started. But if you've got cancer in your bones, underlying heart or lung conditions, or just don't know where to start, speak to an expert. It really helped me. I was seen by a physiotherapist and referred for exercise at my local leisure centre. If you're eligible, this can be done by your GP or cancer team. There are also lots of online resources I found helpful. You'll need to put in more effort to resistance training than you might have before, even if you've always been active. It is still possible to get stronger. The decline in strength usually happens gradually, so it's best to get ahead of the game. It's easier to prevent a decline than recover from it. But don't worry, it's never too late to start. You may have heard the terms reps and sets. A rep is how many times you repeat the movement before stopping, and a set is a group of reps done together. How many of these you do should depend on what you're aiming to achieve and your own experience level. Aim for between 5 and 15 reps of each movement. The resistance should be high enough that you can't complete any more without resting. If this gets too easy, consider increasing the resistance. Aim to complete 2 or 3 sets if you can. You might need to build this up gradually. It's important to rest for a few minutes between sets to get the most out of your training, so don't be tempted to complete them all in one go. Listen to your body and take more rest time if you need it. Aim to do 2 or 3 strength sessions a week, or spread it out so you're doing a couple of exercises most days. Make sure you're getting enough rest between times to let your muscles recover. Alternating workouts is a good way to do this. I like to focus on my arms one day and my legs the next. It's important to complete the full movement, so use a mirror or ask someone to make sure you can maintain good technique before making things harder. To strengthen your muscles, you'll need to move against some form of resistance. This could be weights, machines, resistance bands, or even just your body weight. You can do this in a gym, a group, a class, or at home. If you don't have access to equipment, you could also fill a backpack with some books or use large water bottles. In the days after your resistance training, some muscle soreness is normal and a sign that the exercise is working. But if this is too much, or it's affecting your day-to-day life, you might decide to lower the resistance. This doesn't make it any less effective, and being less sore usually allows you to do more. I struggled with tiredness when I started the treatment, and at first I was a bit worried about doing exercise because I wanted to save my energy. But I know now that strong muscle is an efficient muscle, and getting stronger by exercising little and often has really helped me. Some men might experience unwanted body changes, like breast development, while on hormone therapy. Focusing on training the chest area can help you feel more confident and give you back a sense of control over your body, which I found important. Upper body movements involving a forward push or press tend to target the chest area. Don't forget, your pelvic floor is a muscle too, and strengthening it can help with things like bladder control and sexual function. You can find more information on how to do this at Prostate Cancer UK. Just remember, getting stronger takes time. It might be a few weeks before you start noticing changes. Be patient, stay consistent, and you'll see the rewards. Activities like walking, cycling, swimming, and even golf can be examples of cardiovascular exercise. It's normal to feel your heart beat a little faster or to get a bit out of breath when doing this sort of activity. If you're just starting out, being able to maintain a conversation while exercising is a good level to aim for. Adding in some impact activities like walking, jogging, step-ups or jumping is a good way to improve your fitness and keep your bones strong. This is also good for burning calories and losing weight. But if you already suffer from painful joints, arthritis, or have cancer in your bones, low impact activities like cycling and swimming take the pressure off your joints and allow you to take part with less pain and lower risk. If you've had radiotherapy to the pelvic area, avoid cycling for a few months and build this up gradually when you start back. Finding a comfortable saddle might also help, and most good bike shops will be happy to advise. Try to get out and move most days. Limit how much time you spend sitting and break up long periods of inactivity. It's important to step up your exercise every few weeks by going faster or for longer. Short, regular bouts of activity are better than longer workouts. Using fitness monitors, smartphone apps, or a simple paper diary can help you keep track of your progress and set your own goals. Remember, food is your fuel for keeping active, and you might also have to increase your protein intake with foods like lean meat, fish, eggs, beans, and nuts. If you do the recommended resistance training, you might be advised to supplement your protein. But you should discuss this with your cancer team before starting anything new. If you're looking for help with weight management, you might be eligible for services you can access through your GP. Macmillan Cancer Support have advice on their website, and there are various booklets available as well. Being active really helped boost my mood, but there are also services available to support your emotional well-being. You could reach out to the Macmillan Helpline or visit a Maggie's Centre for advice about mental health if you think this might help you. There are plenty of support groups designed for people like us affected by prostate cancer, so you don't have to go through it alone. Starting hormone therapy can be tough. It seemed that way to me. But if you take an active role in your own health, it can make the whole process a bit easier on both your body and your mind. Being active and focusing on building your strength can make you feel more in control, reduce side effects, and make treatment more manageable in the long run. That's been my experience. Make a strong start, stick to it, and stay strong.